I would like to welcome you to the final webinar of this Policy Answers series. And the title of the webinar is a very interesting one, Looking Back, Moving Forward, Insights on Digital Transformation, Health Policy, and the Green Deal. So 2 years ago, we launched the Policy Answer webinar series to explore progress in the Western Balkans on digital agenda, Green Deal, and forward-looking health policies. And the series opened with an overview of the Western Balkan pathway across these thematic topics. And we had the first three webinars delivered by our regional expert, Bojana Bajic, Marija Jevtic, and Djorđe Djatkov. And that was very much also supported by through stakeholder dialogue at the World Cafe sessions, which were part of the conference in Sarajevo in September 2023. And many of you attended this conference. And then after this conference, we launched this interactive platform and this series of webinar. But 2 years later, this closing webinar marks not only the end of this Policy Answer webinar series, but also an important opportunity to reflect on how far we have come and to discuss where we go next. And we are going to do that again with our three regional experts. As I mentioned, Bojana Bajic, she is digitalization innovation expert at ReSPA in Montenegro. Marija Jevtic, professor at Faculty of Medicine at the University of Novi Sad, Serbia, and Djorđe Djatkov, professor at Faculty of Technical Sciences at the University of Novi Sad, Serbia. So I just want to remind you that on the previous webinars we held and a part of these thematic areas, we focus on many important EU instruments, including European partnerships, missions, smart specialization, also research infrastructures. We managed since 2024 to organize 70 webinars with 26 expert speakers, and impact, we had more than 300 participants and more than 1,000 viewers, because, as you know, all our webinars are recording, they are put on YouTube, and this will be a very nice sustainable output of Policy Answer project. And so I will now start with the green transition topic. And Djorđe, you made a very nice original self-development methodology to quantify green transition achievements in the Western Balkan, building on RCC Action Plan implementation report, and that is part of this policy brief and policy report of which you are author. So I open the floor for your presentation by asking you how far we have come and where we go next. So I will now stop to share my screen, and I give you the floor for your presentation.
Thank you for this nice introduction. I hope you see my screen now.
Yes.
Just a second. Okay, thank you. Again, I will start with this slide related to reasons why actually Green Deal and Green Agenda were initiated. Actually, those were at that time defined global challenges and threats, which are even greater nowadays. And I might say maybe some of them at the bottom of this list are even more intensive these days. As a response of European Union, European Green Deal, and the Green Agenda for Western Balkans were initiated. Concretely, Green Agenda by Sofia Declaration in 2020, endorsed by Sofia Declaration. And also the part of this process was defining the implementation action plan developed by Regional Cooperation Council and by the same institution, first implementation report was published in 2023. Since then, 2 years after our last common webinar, for example, Hamburg Declaration was endorsed in 2024. And this Hamburg Declaration actually reinforced the importance of green transition and somehow emphasized the closer regional cooperation among Western Balkan economies. Also, Green Agenda Action Plan was revised in 2025, and 2 additional implementation reports were published by the Regional Cooperation Council. That is the situation with official documents. And within, as Sanja already announced, two results were published in the form of policy report and as a policy brief as well. From these activities, for example, biggest challenges were recognized, like lack of capacities of all kinds and at all levels, low public awareness, low implementation, and in one word, insufficient governance in the region. Some very important conclusions were also made during our last common webinar in April 2 years ago, wherewith some of them are that Green Agenda is very complex itself, since we realized and we very well know that it comprises of 5 important pillars. And because of that, it's very complex. And but somehow it is connected and have synergies. It's wrapped also with digital transformation and health. They cannot stand themselves alone, and common activities should be conducted. Also, that framework conditions are being prepared, but implementation is not sufficient. We concluded that education, awareness, and capacity building are very important. We need efficient governance, and also during our webinar, we concluded, and that was the input concretely from Marija, very well observation, that health could be namely the excuse for one of the excuses actually for green transition, since human health and human lives are of utmost importance in these processes. From the elaboration of results of RCC report, implementation report, the conclusion is that framework conditions are at that time half prepared. We will see from some other newly reported documents some improvements. Also, regarding the recognized challenges, at that time it was stated that capacities are one of the most missing things in the implementation of green transition. On this example, on Just Transition Fund, which is intended to support vulnerable regions in their transition and coal phase out for the power generation. This interactive map from their portal website is showing that none of the economy from Western Balkans is not eligible to use such funding. And we have exactly the same situation at this time. That means no progress was achieved, and very similar situation can be observed in neighboring European countries, European Union member states. When analyzing in the published documents, newly published documents and the reports relevant for this topic of green transition, I will emphasize only the important aspects that can maybe serve as a driver for our fruitful discussion in the coming sessions. For example, from revised Green Agenda Action Plan, which was adopted in 2025. This is more streamlined and results-oriented roadmap with clear timelines and indicators, and it emphasizes actually new regional deliverables, which means that regional aspect of the transition is very important. Also, there is a report on the implementation report from the RCC, which emphasized that framework condition is improved in all relevant pillars, but especially in decarbonization pillar, comprising of energy, transport, and climate. But also that besides framework conditions, that it was emphasized, for example, that implementation is not sufficient, especially in energy sector and depollution by removing coal from the energy mix. Next, from other reports, it could be emphasized that green transition should not be only observed as environmental obligation, but as well as opportunity to develop industry and also to create additional jobs. From some other reports, education is emphasized as a very important aspect, and also capacity building, and it brought it in the connection also with smart specialization as a chance to efficiently conduct green transition. Also regarding bioeconomy. Bioeconomy is recognized as one of the largest opportunities to conduct green transitions, but in opposite to that, for example, there are no clear developed and adopted bioeconomy strategies in the Western Balkan economies, and this should be the next step for to improve this process. From my side, that's all. Thank you for your attention.
Thanks, Djorđe. I suggest we move now to the topic of health, and then we collect the questions. But for example, if I now ask you, and just you in short answer from 1 to 10, how far we have come in these 2 years in this important topic?
From the side of framework, maybe from from 5 to 7.
Mm-hmm.
And in the implementation, maybe from 3 to 4. Not much further.
Very good. Yeah, thanks, Djorđe. As I said, we will have a question session at the end. And now we move to the next topic, and which is health policy consideration. And Marija, In your report and policy brief, you highlighted very important priorities as crucial to build a sustainable and inclusive health policy framework. And I will, in my memory, will always stay and very strong, like more health policy implementation, less politics, or prioritize the green agenda and digitalization in health. So I now open the floor for your presentation by also asking the question how far we have come in these 2 years and where we go next. So Marija, the floor is yours.
Thank you very much. Thank you for organizing this webinar. I very much like to be between digital transformation and Green Deal. And I think that it's very important to put health in all our sectors and thoughts and actions. So I will use my time to make some kind of professional reflection, but also personal reflection on the Western Balkan health policy trajectory, having in mind that my professional field of interest is health, not diseases, and I will put the accent on the health issues. And because of that, I think that it's very important to use digitalization, but in a right way, and be sustainable not only in outside of healthcare, but also in healthcare. So we need a holistic approach to health. It means when we say holistic approach, it means health in all policies. And it is very good example that we should work together with the AI and digital, and also with the sustainable issues and with the experts in environment and health, because a lot of consequences on health as a population, as human population, we have as a consequence of pollution of environment. And when we talk about health, it's not only about individual health. We should make a difference between individual health and different other definitions of health, like population health, public health, global health, One Health approach, and finally planetary health. But when we talk about health in Western Balkan region, we can connect with the climate and health issues, because our region it's more exposed to climate change than other in general. And of course, we discuss a lot of in our report challenges and solutions, and explore a lot about, we talked about risks and disease, but it's important to make differences between actions in healthcare sector, greening healthcare, for example, and outside of healthcare sector, when we want to increase health, for example, better transport or more digitalization, or urban health actions, etc. So we published a policy brief and a policy report, and I had opportunity to make some kind of dissemination in European Health Management Association conference last year, and also make some continued medical education among medical doctors in Association of Medical Doctors of Vojvodina. And I think that it's very important to increase interest of clinicians in this topic, because they are not enough aware about importance of connection, digitalization, sustainability, and health. They much more involved in disease and trying to find some solutions how we can achieve health regarding some special disease, not only some kind of that like connection in with One Health, zoonosis, for example, or a non-communicable disease, which are also could be connected with the environmental pollution. And because of that, we trying to using principles health in all policies, and we concluded that all our healthcare sectors fragmented in all our economies, and also we mention, and we have a very big challenge with the workforce in a healthcare sector. So we can ask and improve digitalization, and then we can make some kind of solution in digitalization of health, but also we need to increase health literacy among patients. So health, it's a specific topic because we are all potential patients, and we need to be more informed and increase health literacy among population. So sustainable healthcare, it's need to be respecting and implementing energy efficiency and environmental issues, because healthcare, for example, responsible for more than 5% of CO2 emission globally, and also the region. And the implementation of health in all policies, it means different kind of collaborative action-oriented research with the digital and sustainability-focused objectives. And we can then expect improvement of health outcomes. So sustainable and inclusive health policy framework in the region, that is our aim, and greater health policy implementation, as you said, with less politics. It's very important. What is new in last years? It is not only digitalization, but artificial intelligence. Artificial intelligence that it's important to all health professionals, public health professionals, but also all potential patients and citizens. And we can use artificial intelligence in different direction, as a good tool or as a bad tool. So we need to learn how we can use in a good direction to help us, health professionals, but also help us for achieve individual health. And of course, it's very important to mention that we need for all health issues, we need peace and we need empathy. We need to stay with enough empathy in health professionals' work. And we need to discuss foresight approach, to discuss our possible direction in a good way or in a bad way. And for example, one scenario, negative pessimistic, when digital tools continue to expand, but inequalities grow. Urban centers benefit more than rural areas. Energy costs rise without systematic green transition. Workforce migration increased, public dissatisfaction deepens, governance reforms are in stagnation or regression. Modernization is visible but fragile, efficiency without equity, innovation without stability. It is also one way it's possible, but in positive scenario, digitalization supports prevention and early diagnosis. Artificial intelligence is ethically regulated and reduces diagnostic delays. Primary healthcare is strengthened. Workforce reform improves through regional cooperation and educational reform. Green hospitals reduce emissions and costs. Health literacy increases. Public trust grows. That is our aim, to make possible this positive scenario in the future. This positive scenario in the future needed sustainable healthcare, but also a changing in educational process of future health professionals and responsible research innovation in specific topic regarding health challenges. And of course, trust and ethics in healthcare systems. Public-private balance still fragile. We have two parallel systems in all economies in Western Balkans, private and public. Workforce and governance shape credibility. Corruption, it's also present. And corruption is one of the important contamination of our healthcare, and majority of health professionals are very responsible, but we have to be connected with this fact that we should decrease and trying to find a solution to make it as low as achievable. And of course, increase empathy and continuation communication with patient face-to-face and talk-to-talk, not only through the paper, through the indirect communication. So from vision to action, we need to trying to build in future ethical governance with more discipline and commitment, and always with the integration health with digitalization and sustainability, and then we will make better public health results, of course. So that is from me. Thank you.
Thanks a lot, Marija. So again, as in the case for Djorđe, we will leave questions at the end. I just want to make one remark. I'm very happy when we were planning at least this work package within Policy Answer that we integrated health policy as important thematic topic together with the Green Deal and digital transformation, because I think it's really, I would say, for Western Balkan, most important thematic topic. So I just, before moving to Bojana, again ask you the question, because you had this beautiful report and beautiful policy brief, and you put a lot of recommendations in and pointed on challenges. So in these 2 years, how far we have moved?
Not very far, because we have a different kind of external challenges. But I think that artificial intelligence is something which is very present in healthcare among health professionals, but also among patients and citizens. And I think that we need a strengthening partnership with between health professionals and patients, but and using in the right way artificial intelligence. I think that we make some good steps, positive steps in green transition, but we have a lot of challenges in public and private healthcare in all countries, in all our economies. And I think that workforce for us, it's a big challenge.
Yeah. Good, thanks, Marija. So now we move to the next topic of digital transformation, maybe the most dynamic topic. And so, Bojana, in 2 years ago, and in your report and policy brief, you emphasized the importance of aligning the Western Balkans with the objectives of the Digital Compass 2030 across 4 key areas, but also you strengthened the need for new mechanisms and dedicated institutions for effective management of the digital transformation processes. So now I give the floor to you by asking the same question: how far we have come and where we go next. So, Bojana,
thank you, Tanya. Thank you, all colleagues. It is a really great opportunity to be today with you here, but also to work on this very important topic. Djorđe and Marija mentioned digital many times, and the digital part is really very important, and all of us have to be focused on the best way to use all opportunities that technology provides to us and to any our activity in the health, in the green, in the economy, everywhere digitally and artificial intelligence are actually emerging technologies are here. And we really have to be aware how those technologies are important and how to use them on the best way. When we go back to the 2.5 years ago, I put the picture from the event in September in Sarajevo. I can say at this event we discussed all 4 straits related to digital compass, and we discussed about government, connectivity, skills, business. We can see the pictures which are results of our World Cafes, and we then identify many challenges, many opportunities as well, and the policy brief had a lot of recommendation. I will today briefly, in 10 minutes, try to explain that I cannot say that I'm not satisfied. I think we did something. There is a reform agenda, which is very important document for all Western Balkan administrations. And based on this agenda and activities recognized in this agenda, I think all our countries did something. For this report, or actually for this presentation, I used first my personal experience, because I'm working in the international organization, who is responsible to support public reform, but as well to support the administration in Western Balkans. And from the 1st of January, administration in Ukraine, Moldova, and Romania in the process of digital transformation. I used any knowledge I have from other colleagues in this area, but also use the available documents who are very representative and very important for this topic, such as you mentioned digital compass. Yes? Can you hear me?
Yes, apparently somebody did not.
Somebody maybe should move.
Maybe Desiree can help.
It is better maybe to move.
Audience don't switch on microphone.
TESI index, government survey, GovTech maturity index, Sigma monitoring reports, E2, International Telecommunication Union statistics, European Commission enlargement country reports. And based on those data, as well as if we have in mind the European Digital Decade, Digital Compass, and targets for 2030, I will just briefly pass through the targets: 80% population with the basic skills, 20 million ICT specialists, 100% gigabit connectivity and 5G coverage, 5% enterprises, using cloud AI, big data, 100% keep public services online, and 80% of citizens to use electronic identification. I can say what is the situation in the middle of the period. We have EU snapshot actually from 2025, but we are in 2026 and are using the data from 2025. Member states achieved many of results in this period. Will they achieve until 2030? We will see. But also we can see where are in the Western Balkan region, and my personal view and understanding of the current situation that we have to work a lot, but we did also good things, especially related to digital skills. We were recognized, as Marija mentioned, artificial intelligence as most important education. We have to think about AI framework, competency framework, and to see how to use AI, actually how to use the best side of the artificial intelligence in daily work. When I'm mostly talking about service delivery and how digital transformation make a big impact to to public servants, to government institutions, to service delivery from their side. And we can see that in all areas which are relevant for digital decade goals, we have some results. Maybe the last result is in digital ID usage, but also we are working in this ReSPA supporting programs based, which are relevant for all digital decade goals. And I guess I can see that the administration are working on the legislation related to digital ID, to work on trust list and to recognizing their trust service providers in member state trust service listed. And they are aware how important is the digital transformation and how important is to work on a key, to work on implementation of the law and on establishing very important key points relevant to digital decade goals. I will just briefly pass through all 4 directions, but basic skill, AI skills, it is AI competencies, I mentioned it is really very important to have in mind and to work a lot on this. Infrastructure and cybersecurity, NIS2 direction is relevant for all Western Balkan administrations, and all of them are very focused, but still have a lot of work to transpose this NIS2 directive. Business digitalization innovations, how to connect. I expected from you the question related to what is the score of our achievement in this period, but how to achieve the goals where you have the technology who are faster than all of our activities. And we have innovation in the private sector, in the bank sector, who are more improved and more implemented than in government sector, and have to have in mind how to use their experience and to work on public-private partnerships to support the government to be faster in this way. Because digital government depends of national e-services, digital ID framework. We have a lot of data. We have data sharing between the institutions in the government. I will not talk yet about cross-border interoperability, but when we talk about interoperability in the countries, we still see potential for better cooperation, and still there are silos that work only by themselves, and the interoperability has to be more implemented, and open data maturity is below the EU average, and it is also the topic that we have to have in mind. I will just briefly pass through the administrations, because in the previous reports, I I explain why the Albania is stands out as a regional fund running a digital government because they are working a lot on service delivery. More than 95% of the services, maybe close to 99 now, is online, and the service delivery is something that on what they're very focused and what is very important for public reform. Infrastructure connectivity, broadband penetration is very high. The digital infrastructure is improved, and they are working on a 5G expansion. Digital skills and workforce, introducing coding in early education, expand smart laboratories in schools, and the innovation and governance and legal framework. Albania is very aware how important are the strategies and all legislation relevant to use of artificial intelligence in public administration. In Bosnia and Herzegovina, we have a little bit of situation in cooperation with the previous report, but I can say it's still early stage of digital transformation because of the specific situation in this administration. There is a gap in legislation regulation, or that also depends on the organization of the Bosnia and Herzegovina. There are challenges related to infrastructure. They're dedicated to the digital skills, and it is something what is on what they are very, very aware that is important. And interoperability is also a key challenge because there is a small limit in coordination between groups which are established to support process of interoperability. What is the new in Kosovo? 100% they were leader before related to connectivity, but what is the new from a week ago? They established a new Ministry of Public Administration and Digitalization, and it is really very important because when the government recognizes that the main institutions has to be established, it has to provide all activities related to digital transformation, it is crucial for the government. That was one of my main points from previous report, because I recognize Serbia, Albania, and now we have the situation in Kosovo, but also in North Macedonia, the similar, that they also have a new Ministry for Digitalization. And I think that establishing the government institution that is responsible for this topic is really key to be successful in this area. In Montenegro, very, very high broadband, expanding 5G, a lot of services are developed, but still there are, I cannot say issue, but still interoperability is not actually principal once and only, has to be improved and more implemented in the government related to government services, but also in to use the government service bus for all services that can be provided through the system, and that can be referred to use the data only once. It's not necessary to exchange or to save data on the different places. Also, Montenegro established an agency for cybersecurity. It is based on NIS2 regulation, and it is really great news from Montenegro, because they are very aware how cybersecurity is important. Digital skills are, I can say, solid, but Montenegro established a digital academy and provides different trainings and schools related to artificial intelligence, open data, and it is very, very relevant for Montenegro. I hope better success in this area. I mentioned before a new ministry in North Macedonia. It is really very important because the North Macedonia, through this, recognized how important it is to have the body, government institution which is responsible for digital transformation, new strategies related to cybersecurity, strategies for digital transformation are adopted. Skills innovation also are recognized, especially in the public administration. North Macedonia established a part of Ministry of Public Administration which is dedicated for education of public servants, and it will help North Macedonia to achieve all goals recognized in the reforms agenda. And Serbia is again has a digital infrastructure. They have a high interoperability, and the e-government system is very, very good because, as I mentioned, they have Office for IT, and that office works in the process of coordination activities related to e-government, what is extremely important for the success of digital transformation in any administration. Everything is they're trying to be aligned with EU alignments, and ICT is recognized really as a very, very important strengthening in the development of e-government in Serbia. And just briefly, we mentioned before in the previous reports, but when we talk about challenges, I can say that there are the similar challenges in member states and in our administrations, and those are digital skills gap, AI, and use of emerging technologies in the daily life and work. Interoperability as a key challenge for all activities related to digital transformation, as well as data sharing. Cybersecurity and resilience is also a result of NIS2 implementation, and it's a horizontal task for all administrations. Regulatory and implementation gap. When I talk about this, I'm talking about many new acts which are adopted in EU and which that have to be implemented, actually transposed in Western Balkans administration. It is a huge work, and it is not just a task to transform the legislation. The legislation should be implemented, and it is a really big challenge for all administrations. And as I mentioned before, public and private investment, we have to have in mind how to support administration to establish public-private partnership and to improve digital transformation in their own administrations. Common challenges I will just pass briefly, but it is always interoperability, data, leadership, legal, cybersecurity, AI readiness. We are talking a lot about AI. All, I think, citizens, employees, everyone using some tools. Everyone is talking about AI. All of us used AI tools for some reason, but I think AI readiness is on the very low level. And since we did the previous report, there is a new AI readiness tool, massive open online course, which is established by UNESCO. And I really here recommend to use this AI tool and to learn more about how on the right way through the 6 different modules use AI and learn about AI on the best way. And the last slide are recommendations. Again, central coordination, I think it's very important for the digital transformation, for the qualitative and quantitative use of digital transformation in the region. To accelerate interoperability, principle once and only should be mandatory. Use advanced AID and trust services. Cybersecurity resilience as a horizontal issue is the most important part, but it is a foundation for safe use of emerging technologies and technologies in daily life and work. AI governance capacity, it is a huge challenge, and it is my recommendation to be focused on this and to create really framework for AI, which will be safe and will secure the right way of using AI in any situation. Sales quality and inclusion, it will come like a result, but also have to be focus on this and all the time do monitoring and evaluation of all activities which are provided to this. As all reports are due, which are prepared, presented in the second or third slide. Monitoring is important, and evaluation also are crucial to see where we are every year, every moment, and do we do the good or not so many good things in the process of digital transformation of the region. Thanks.
Yeah, thanks, Bojana. Also, thanks for making this review and going from one West Balkan economy to other. And it was also in the past very interesting to see that in each of them there are some kind of best practices which can be really also highlighted in EU and not only within the West Balkan, which we always think that we don't have enough examples to show. So maybe now, since we have 9 minutes left, I would like now to open the floor for discussions and questions. I see that there were already some kind of, in the chat, there were some kind of comments, but maybe Miroslav, you want to bring in now to everybody in public the news from Serbia? Miroslav, you are muted. And we don't hear you, Miroslav. You are muted. You are still muted. So apparently Miroslav has a problem with his microphone, but I can read his comments in chat. He said it might be interesting in regard to green agenda in the West Balkan to mention that Serbia is considering development of nuclear energy sector. And maybe now, Djorđe, you can comment on that.
Yes, it's well known that nuclear power is also integrated in Serbia's integrated national energy and climate plan. But Professor Vesković meant probably that further steps are taken in order to implement this energy in Serbia. Actually, it was in the integrated national energy and climate plan. It is considered as one scenario.
But is that already like a location known, or just really again some kind of feasibility study done, or just the concept or idea?
Probably that Professor Vesković, yeah, pre-feasibility study.
Okay, that's really good news. At least I can say that maybe some people will not agree, but I think it's really good news. And it's now, I mean, in EU, among the EU countries, and also EU is preparing new strategy for using fusion for energy. I think this is also a big challenge, but maybe a really bright future for energy. So are there any other questions for Djorđe, Marija, and Bojana? I don't see any hands raised. Yeah, I'm sure you have some questions. I don't see any hand raised, but maybe I can ask you, Djorđe, you mentioned like the perception for green agenda is like protection of environment. That's also what I really see in particular Western Balkan when they discuss about green agenda, but you mentioned there is a big potential for economic growth, for job creation. Do you have any concrete examples and that is really visible to the Western Balkan that we don't talk only about environmental protection?
I don't have really new examples right now, but it's a slow process and needs investments. That's a tricky point.
Yeah. I think we are in this racing party. We are not yet on the top.
Yes, and if you look at the elaboration of RCC report and quantitative assessment, maybe the largest progress is actually in the pillars which require actually more investments.
Mhm. Like
Somehow,
energy or what?
yes, energy, decarbonization, circular economy, and agriculture. Maybe some other pillars like nature and biodiversity are lagging behind.
Probably because that were in the past the strongest traditional economic sectors, I assume. At least the case in Montenegro. I don't see any other hand raise, or maybe you can.
I can.
Yeah, Marija.
I can add something, my personal expression that, and in general, that healthcare is very expensive. And then in the future, we should move from solving disease to saving health. So prevention, to put all accents in health, using environmental protection, Green Deal, green transition, and to increase health literacy, but not only health literacy, climate literacy, environmental literacy among citizens. Without citizens, we cannot move from our expertise to result. Without partnership with citizens, and also I expect, for example, in medicine, deep challenges in the educational process, in specialization, in the future everyday job, in different kind of specialization, and also in primary health care. So we can use digital and artificial intelligence to help us to have more time in connection with the patient.
Yeah.
Not too afraid about artificial intelligence, but use this as a solution to achieve more time for personal contact.
Yeah. Let's say from my experience and in direction of the topic of health, and maybe Marija, you can comment, but given that I initiated large-scale research infrastructure for cancer therapy, cancer research, my feeling is that there is really some kind of, let's say, people don't like to accept that going further step, you need new technologies, you need research. And I still think that this is the problem, that politicians don't really understand that investment in research and technology really bring the value in all aspects. Somehow I really feel that like this is one of the problem in the Western Balkan region. They don't trust people that you can bring some large-scale research infrastructure based on new technologies. They still look at that like it's science fiction for our region. And here, I think probably also the user community is not easy to, it's not easy movable. Let's say it's not self-organized, that we are missing bottom-up, but we are missing also top-down approach in such like big steps.
And also there is no balance between investment in tertiary healthcare and prevention.
Yeah, exactly.
It's not the main aim to solve cancer, but not to
Prevent.
be in contact or be a cancer patient.
Now we have 1 minute. I don't see hand raised, but I will bring some question to Bojana based on, again, my experience. Okay, we have hand raised, and I see RS. I don't know the name, but please, I just give you the possibility to ask the question.
Hi, I'm Rosalinda Stoyova, and I'm from North Macedonia. I'm usually a guest of your webinars that I like very much, and I thank you for your invitations. I would like to add something in regard to what Bojana was talking about, the digital transformation. Recently, 9 months ago, I have read one very, very nice definition about the digital transformation given by the CEO of one company, but not an IT company, a company, any company. And the guy said the digital transformation is not something that you can delegate. It is either you own it or you don't. So it's a top-down approach. And when we are speaking about the political will, I would like to tell you about two case studies in Macedonia. One is from the private company, a farm, chicken farm that produces eggs. And the CEO, the owner of the company, he said, either we go with digital or we are not doing the farm. And he always, either if he's on skiing in Switzerland, he knows every step in his farm, when and what are they doing. So this is nothing connected to IT or something like that. He's just a farm guy. But he decided that from the top down, that it has to be digital. And the second case, very good case, case study in Macedonia is that the new government established a year and a half ago, decided to empower the previous Minister of Digital Transformation, one of the previous ministers, as a Minister of Health. And in fact, he decided that he acknowledged and recognized the quality of data that they own and decided to change the system of health care, not the medicine itself, because the medicine, we should leave the medicine to medicines, to the persons that are experts in medicine. But he is changing the way the system goes. So we as a patients, as a users of healthcare system, are going faster and without any barriers to get to the final results. So not always the Minister of Health should be a medicine or a politician. He is an IT guy. PhD in IT, but he knows what he's doing. So the top-down approach is very important. And if we are speaking about political will, it's something that it should be pushed very hard, according to me. So I would end here.
Thanks, Bojana. Do you have any comments? And then after that,
perfect example, because I know the minister from North Macedonia, and it is a really great example. Thank you, Rosalinda, because he started immediately to use his knowledge in IT and in the technology, and to improve the system on all levels, from the primary level go top to it is a really great example. But what I used to say, not only, but digital can transform many things. But we have to focus on this, how the best way to use this. This is just a tool, this is just technology. We are human beings, and we have to know how those tools can help us. From my point of view, I'm using technology for everything in my daily life. I am doing a lot of things. I'm hard worker, but I have a lot of assistance, because technology is my personal assistant, and I recommend it to everybody to be open, to think of on which way the technology can support you. When we talk about digital decade and the 2030 goals, my main message is let's think about once only principle and use data one data for everything, we will solve many problems, and we will be more happy. Sure.
Very good. Now I learned that it was Rosalinda, because probably you recognize her voice. I could not.
Yes, you know, because Rosalinda was on the conference. He's my colleague and friend,
Yes,
and
I know.
she's really expert in this area.
Because I could not, from the label, I could not recognize. So I think now we are coming to the end, because we already approach 4 o'clock. And I have one slide now to show. And that again, that we have now reached the end of this webinar series, and Policy Answer project will conclude at the end of the April. But its success will hopefully start soon, and I'm sure that this interactive platform which we have built is going to be taken by this successor project. So I'm not going to continue this project, but I would like really to thank you all. I want personally to say that I really enjoy very much working with all of you, and I'm happy that I got connected to many of you. And so I want to thank all participants, all speakers, also to today's speakers, and to all active contributors. So with this, thanks a lot, and I'm sure this webinar series will continue, as I said, with the successor project. So thanks a lot.